Some people who have caught the new strain describe a very bad sore throat.
So basically, the back of their throat is all irritated, and when they're trying to swallow something, it feels like that's been described as shards of glass.
It's part of a COVID family called Nimbus. The CDC expects it to become the dominant strain soon. Here in San Diego County, case numbers are still low, just 317 reported the week of June 7th, but hospitalizations have inched up.
The big caveat is that people who are at high risk for COVID still are getting hospitalized. People who are taking various kinds of chemotherapy, people who are immunosuppressed, or the very old elderly.
Dr. Davy Smith is an infectious disease specialist at UC San Diego Health. He says it's human nature to want to downplay the risk of COVID. Pew Research recently found 80% of people report rarely or never wearing a mask. And more than half say COVID just isn't something they worry about much these days.
I'm tired of hearing about it. I'm tired of talking about it, but it's still a thing. So it doesn't mean that we can just totally ignore it anymore.
Smith says COVID is now part of the seasonal virus landscape, along with RSV, the flu, and other respiratory bugs.
That when we start developing symptoms that look like a fevers, chills, cough, and now a big bad sore throat, we're going to have to say, aha, I need to get tested for COVID.
The new variant comes as new federal guidelines say most healthy adults under 65 aren't routinely recommended to get COVID boosters.
The question that I have around the guidelines is who's going to get really sick and have to be in the hospital and who will ultimately die of the infection. Will these guidelines change any of that or make it worse or make it better?
He says time will tell. Heidi de Marco, KPBS News.